We're going to call to order the Tuesday, March 12th, 2024 Advisory Board of Health meeting. It is 5 p.m. We are in Town Hall, room 119. Our first order of business would be to approve the December minutes, which were distributed to the group in December. Any changes? All right, we will move those that are posted online to final. Our first item of business is a report from the Director of Health, David.
Thank you. It's good to be together for the first time since pre-COVID. It's great to be here. And good to see you all in person. I just wanted to start by kind of going over, and I believe I sent you PowerPoints and some information from prior to when I was brought on board to be the first full-time health director in the town. And it's really interesting because we're kind of at that point of assessing where we want to go as a health department in the future. And I think our health needs assessment will help us make some decisions in that regard. But in the context of where we go and where we are and what we've done, I think we have really followed and achieved a lot of what the advisory board set out for in 2007, with what the health department was to be, how it was to be kind of like staffed, and what we were supposed to be charged with as our mission, as a department's mission. And I hope that I have fulfilled the goals that were outlined by the board at that time. Kevin is the last man standing from that group, and you are to be commended for your perseverance, Kevin, I think. But it's been a really rewarding experience for me, and in finding this PowerPoint and sharing it, I think we have done that, and I think that our mission going forward still has to kind of stay along these same lines, in my opinion, and utilize and take advantage of the environmental piece of what we do. The environmental piece being food service, the septic inspections, and just the mandated responsibilities of this department. I think it's got to be a focal point. And as we move forward and hire a new director of health, it would be my hope that the town would look for a person who has an environmental background, because we don't have the luxury of having a large staff. And I think it's really important that the person at the top have the knowledge for that, because a lot of people who are qualified to be a director of health because of the degree don't have that experience that's necessary for running a department like we have here. And I know that at the time there was a discussion about health districts and some advantages that a health district might provide to the community, where you can have more people that have a wider range of backgrounds to be able to provide more services. My prior employment was with a health district. I worked in a health district of 10 towns. And I was in that district as it expanded from 3 towns initially to where it was when I left at 10 towns. And I can tell you that as the districts get larger, you lose that community sense with the department the larger you get. Because you have one health director for 10 towns. For the life of me, I don't know how districts survived COVID. When you have 10 selectmen and mayors wanting input, 10 boards of education and superintendents of schools needing guidance and input, and the myriad of other organizations and businesses that are looking for guidance, I don't know how you can do it in multiple towns. So there's certain advantages of being in a district, but I think the disadvantages really far outweigh the advantages. And I'd be more than happy to discuss it, you know, over the next few months if anybody really wants to have a more in-depth conversation about that. But as I said, you know, I spent 30 years working in a health district prior to working here. Gave away too much information, didn't I? The number of years here. But my first job was with the state health department, so I have the perspective of seeing it through the local health department and state health department for the roles that we do in public health. This has been my lifelong occupation. So I think that I have a fairly unique perspective in seeing what works and what doesn't, and what works best and what doesn't.
Do you think there's a push to go that direction of having
and
multiple times?
part of the reason, and the state is very much for it, and what they do is we get no state per capita funding, and only jurisdictions that have over 50,000 people get state funding, and the purpose for that is to provide a financial incentive for communities to regionalize. That's, you know, where I came from. I mean, that was a health district that included towns like Farmington, Simsbury, Avon, you know, as well as Barkhamsted and some of the smaller communities. But some of those towns could, you know, go in on their own if they wanted to, but there was a financial incentive that they felt was worth it to join a district. So that's one way, and I think that you will hear regionalization and, you know, cooperation, and I believe there's reasons to do that, you know, to have in certain areas where you can have a collaboration between communities. But for something like a health department and the type of work that we do in responding to a pandemic, for example, again, I'll say it again, I don't know how they did it. I don't know how they did it. And I don't know the level of service and the timeliness of response. And I don't think that you will find a health district that will respond to a request from the public in a manner any quicker than what we can and what we do here. So, very staunch advocate for our own department. And, you know, and one of the reasons why we've, I think, been as effective as we have is because we have qualified people here who understand what they need to do. And I'm happy for that. We've been fortunate in that regard. And going forward, I think it's critical that we also maintain that level of expertise for our staff.
David, I do know that there's going to be a small group, informal group at the moment, I guess, coming around and kind of reviewing and renewing and refreshing the charges of some of the particularly advisory boards.
Yes.
So I've been asked to give some input on that. I'll let the board know when that is and get feedback and input from folks.
Yeah, and I did also come across the mission statement for the Advisory Board of Health from December of '07. I think I sent it to you. And it's interesting.
Yeah, reflects very much the thought and times.
Yep, yep. And so with that, I know that there will be some changes, but I'll be one of them. You know, and as I said, you know, if you have any questions about my, you know, want to talk about the local health department differences and, you know, advantages and disadvantages, I'd be more than happy to have conversations with you or anybody about that. I did speak with the first selectman about it and gave him pretty much what I just said to you as, you know, from my experience, what I thought would be best for the town. And that kind of dovetails into my staff update that I have to talk about succession planning and filling the Director of Health position. I do know that what we have done, what the town has done, is actually had financial investment in providing and assisting Mindy Chambrelli, who is our senior sanitarian, into obtaining her Master of Public Health degree. She's fully qualified, and she does fit that description of somebody who has a very strong environmental health background that I think would be ideal for this position. And I caution the person who has a lot of, that doesn't have that level of environmental background, because at this point, that is one of our primary functions, is doing that work.
Yeah, and I agree, because I have an MPH as well, and I am not qualified in the environmental, so I really can see through these meetings how important it is for someone to have that environmental background. You know, there are 3 schools in Connecticut of public health, each of having a different focus. The one I went to had mostly community health education, where you went to, it was a lot of environmental and health services administration, right? And then Yale is different, it's a lot of research. So it would be really important to draw from a pool of applicants that does have that environmental
And there aren't many.
component. No,
There aren't many.
no, so, yeah, so it'll be challenging, but good.
Yeah. So, again, you know, I'd be happy to discuss that further with you. I know there's a lot of people out there with MPH degrees, because our schools are Southern and Yale and UConn
Right.
are, and I think there may be a couple others that
No,
are
that's
working on,
Oh, we're working on it.
getting degree programs, but they're not offering really kind of any training in environmental health. So, and again, you know, that's a lot of what local health departments do. Now, where we go in the future, again, may depend on the outcomes of our health needs assessment, but I think that even in that preliminary review, we're in pretty good shape in that regard. You know, I mean, for programs, awareness programs and education programs, sure, an MPH might be helpful, and that was one of the things that I had been advocating in the past year or so, was for an assistant director or an epidemiologist who's a program specialist to do some of that work. You know, but if we need to do that, again, you know, the health needs assessment will point us in that direction, I think. I think in the previous meetings I had mentioned in December, I think I said that Paula had indicated that she was going to be retiring at the end of this fiscal year, but she has reconsidered, and she would like to stay on. So we will not.
So it's a false alarm.
We will not have to look to replace that position right now. And you know, that's something that could be looked at should and when and should she decide to retire, how we want to fill that. You know, if we're not doing immunizations, we're not doing, you know, vaccinations, then maybe we don't need a nurse, and maybe an epidemiologist or a program specialist could be something that we would consider for that position, just saying. So we can see how that plays out.
Does Paula, besides immunization, does she do anything like doing some home visits for people who might need some kind of healthcare, doing any of that kind of assessment, or would that be mostly going through social work?
Paula, the only home visits that she was doing was providing vaccine.
Right,
So when we were doing COVID and people were homebound,
Right.
we would go to the homes and deliver that. And we did not do seasonal vaccine delivery at home, so no. One thing that she is doing, and I think has been really helpful for us, is she's been inspecting our cosmetology salons. Because, you know, a lot of the procedures, I don't know if, you know, you gentlemen realize this, but there's a lot of procedures going on in those salons that borderline on medical work, you know, with some of these exotic treatments and so on that are happening. And there's more things coming on all the time, new procedures. and it's hard to keep track of what's going on. So we feel that's a good place for having a health professional, like a nurse, to
I
go in and see what they're doing.
I think it's important to have a nurse still in the public, in the health department, because I'm also a nurse, so to have that perspective,
Yep.
you know, in the medical perspective, because it's, they have an education and awareness that other, even paraprofessional kind of people, or other people maybe in program specialists in public health or whatever, may not have that understanding, so I think it's good to have someone on staff like that.
Yeah, and it's also helpful to do follow-ups from some of the
Follow-ups,
reportables. To
community
do
health
interviews.
education.
And she does a lot of that, so when
Yeah.
we have things we need to follow up on, that's the role that she does.
Right,
fills.
yeah, good, okay.
So has there been any second guessing on not doing flu shots, or is it just
Not
worked
at
out?
all, it's
That's
quiet.
good.
You know, and, you know, kind of the shrug was, well, I can go to CVS or, you know, Reeves anytime I want.
Mhm.
And, you know, not really, the only comment that I received was from a town hall employee who kind of said, well, you know, it was convenient for us to be giving them here, to them. And now they'll have to go to CVS.
Yeah.
But, you know, I said, you know, as I said, you know, it's convenient to you if you were here on that day at that time when we're offering the vaccine, because we just didn't do it all the time.
Yeah.
So,
It might be more convenient for me to go to CVS than to come to one of the clinics.
absolutely, and I think that's what we found out.
You know,
You know, the crowning example of that was when we did the vote and vax, and we didn't give one vaccine that night because nobody wanted to pay and get reimbursed, because they could do that at CVS and not have to pay anything.
mhm.
So it's like, okay, that was kind of it for us. In January, Jovan Williams started work as our new full-time sanitarian. And critical role that he's filling is for these new establishments that are coming online. In the last quarter, 6 new places opened. And we're in a process of reviewing and in between the plan reviews and opening for at least another 6 right now. And we're getting feelers for others. And we know there's others pending at Heights. So his role is going to be to do the plan reviews and then oversee the construction while the work's being done to make sure that they're following the plans, because we had a disjointed way of dealing with this before when we had a part-time work from home person reviewing plans, because they weren't going in to see what they were reviewing if that was what was being done. So his role is to follow it through from the beginning plan review, through the construction phase, and then through when they pre-opening and then the opening inspections. And of course, he's doing regular inspections as we go on, both in food service and in septic, because he's got the septic background too. So right now, we're really in good shape with that environmental component for the department. Yeah, we were fortunate, I think, to get Jovan. We weren't really flooded with applicants. Really weren't flooded with applicants. And he turned out to be, I think he's going to be, again, a real asset to the community. He knows his stuff. He's got a lot of experience. So in hiring Jovan, we didn't need the part-time, temporary part-time food service plan review specialist. So, but it was so critical that we had that person until we could get this full-time sanitarian on hand. And as Kevin knows, Nick has been working on getting the mobile pod in a box.
Let's just be clear, Kevin and Nick have been rolling up our sleeves and painting the inside of the box for the last couple of nights, yes.
We need pictures.
I meant to grab one and I thought I did, and I guess I didn't, but.
Otherwise, it didn't happen.
It is, so the trailer is at the Public Works. I'm happy to give you all maybe give us another week for some more painting, but we have several coats on all the walls. The floor looks really, really good. Radios are in. 2 of the 5 radios are in. Because those are, like, believe it or not, 2-year lead time order. We ordering the technology, and I think a number of recs were sent over recently, right?
Yeah.
So Nick's gonna, as we had planned, Nick and I worked on the vision. I kind of drove that through the ARPA committee, down to the selectmen, down to the Board of Finance, and ultimately there was no discussion on it on the RTM MAC, right? But I was prepared to present to all of them. I ended up doing a couple presentations. But going forward, as a part-time employee of the health department, Nick is going to be driving kind of more of the ordering, requisitioning, procurement, maintenance, and accounting for that stuff when it's in a box, because we're paying
Right.
to do that.
He submitted a list to Michelle yesterday.
Great.
So getting underway with ordering some of that stuff. And so that's exciting. Glad to see that moving ahead. So I don't think I have anything else to add on the staffing side. So I'll move on to our budget. I had a very non-controversial budget review session with our town administrator. I thought it went very well. We didn't really ask for that much this year. And so we weren't really, we didn't run into any real significant difficulties with the budget proposal, and I think we pretty much got what we asked for. Again, we're not asking for anything additional. We did talk about the potential for a new position. As I said, how do we deal with particularly if Paula was going to leave. And so the thought was, well, it'd be best to wait until the next health director was on board to actually set that direction and figure out how to best move forward. So we didn't request a position based on the fact that, I informed Kate that I was going to be retiring in June. So it is what it is for the year. Did learn today, that our software program that we use for doing our digital inspections is going to be phased out. The company was bought out, and it's going to be phased out over the next 2 years. And I don't know what it's going to cost, but it's going to cost more than what we're paying now. So I have a meeting scheduled in April with them so that they could review what we currently have and tell us what we could expect that we will be paying when digital health is gone, which is at the end of 2026. It's going to be shut down.
Are there other towns around us that use the same,
Yes.
so
So we're not the only ones in this situation. And I do know that the platform that they're migrating to was always considerably more expensive, because I know that they weren't selling the digital health department that we have anymore. And I know that other departments are looking for software programs to do what this does. And the prices they were getting were significantly higher than what we've been paying. So people are reluctant to go with it. They told us in today's conversation that don't expect it to be that much of a difference. We'll see. I've heard that before too, as we all have. So, more to come on that, and hopefully in June we'll have some answers, because obviously this budget year is already set, so it's not like something that we're going to be able to do, and yet we don't have to transition until the following year, but we're gonna need to know those costs. Any questions about the budget? Where we are, where we're going?
How much is your budget up this year?
Ours? 4%.
4%? A lot of talk in town about the large increases in the budget.
Yeah. Yeah, our increase though is in part, there's expenses associated with having a new person. 4%'s not bad, because we have a new phone, we have more mileage, we're gonna have mileage, although we're carpooling. So we had 2 cars assigned to the department. There's 3 of us that go out in the field. So what we're doing is we're carpooling. Because Jovan's coming, he takes the train in, he's a long distance commuter, as I am and as Mindy is. So, we're all coming from a distance to get here. But there's a couple things that are costing us more money because we have another person, so that's one of the reasons why our budget's a little bit higher. And the overall salaries picture would be higher too because of that, the new person.
Didn't we talk about raising fees, like for the inspections and things, I can't remember what.
Yeah, we talked about it and I reviewed it, and our fees are still amongst the highest in the region, in comparable communities. So I didn't feel that we were at the point of having to raise them. We did adjust our food service fees last year because of the FDA food code. So because they reclassified the restaurants, and so we had to redo our fee schedule and reclassify, and that ended up being a net increase, but not that much, because again, our fees were already amongst the highest in the area, and we didn't want to, push the envelope too hard. But I can tell you this is the first year that I can remember when we're doing our permit renewals. Annual permits expire at the end of December. And we did not have to assess a single late fee this year. Everybody got their permit applications and permit fees in on time.
That's great.
First time. It's amazing. And we're also, as far as fees are concerned, I think we're doing pretty well with that because of all the new facilities, because we charge plan review fees. So, there's a pretty good chunk of income or revenue for the town through that. So, but as far as fees go, I think we're still not at a point of thinking that we need to adjust them. Didn't recommend it this year again. And there's been a lot of fees that haven't been touched since in the 15 years that I've been here, because we were that far ahead in what we were assessing businesses and construction, new homes and so on. So we were way ahead in what we were charging, and we're still at the top. I also wanted to summarize some of the funds that we're getting in grant funds that we have accessible to us. Quite a bit of money that we could do some programmatic things with going forward. I just want to spotlight, the first one, the ELC2 monies, they're available until March of 2026, and we could use that to finish whatever paying Nick for doing the outfitting the pod in the box and the community health needs assessment. That's what that's going to go for. Immunization, we're not doing the immunizations, but we really feel that it's important that people get immunized, get their vaccines, get their children vaccinated. So we're going to be participating in a regional program to promote and advocate for the importance of vaccine. There's a lot of political pushback in the world these days against vaccinations, and I think this is a worthwhile use of these funds to do some educational programs. And it's not just going to be us, we're going to partner with some of the surrounding communities.
So David, about immunizations, a lot of older people, you know, all of us and people older than us have been immunized as children or had the diseases naturally. What I'm wondering is, say for example, the measles outbreak, it's in Florida and California and elsewhere. Is there any funding or anything that we could do to encourage people who are been vaccinated a really long time ago or never vaccinated and had measles, for example, naturally to get a blood titer to see where they stand? Because to me, it seems that some people may benefit from, as an adult like us, an immunization if they don't have any titer or very minimal titer.
So what we have is we have funds allocated for media outreach. So that could include that. The media outreach could include, you know, advising people, you know, trying to reach out to people and providing that information in
Measles,
various.
polio and, you know,
Yeah,
other things
you know,
that they
yeah.
may have worn off by our age.
Right.
You know.
Yeah, pertussis. You know,
Pertussis, right?
That's a big one
Yeah.
too, so.
All of them,
But yeah, I think that money, immunization monies, everybody's been given a breakdown. They could use a certain amount of money for the media. And so, you know, I reached out to my colleagues in the area to try to put together a regional approach, because I think that there are times when regional stuff is more effective than local, and this is one of them, I think.
Right, right.
So, you know, we partner with other communities. More money, stronger message. We have a workforce development monies, that's a total that's only available, that's through November of 2027. Originally, we had hoped to hire the sanitarian much earlier than we did. I was hoping to get him or her on board in August. And it just took that long to do it, and that money was going to be used for that purpose because we only had it in the town budget for a half a year. So, but this money's still here in case we find a use for it, and there's a whole plethora of things that could be used for workforce development, including educational programs, incentives, bonuses, and, you know, pay increases. But it's only a one-shot deal.
Yeah.
Money will be gone.
Yeah, I'm also aware that something that the community doesn't really talk about, because I guess there's a stigma or they just don't want to deal with it. But there's a lot of people who have complained about rats in the area. And anytime too, when there's all this major construction going on, building, you know, going into sewer lines and this or that, they dislodge rats apparently. And then they were saying too, after COVID, or during COVID, when the restaurants weren't open, the rats were going into residential areas and down by the water and whatnot. New York's got a major problem, and I'm wondering, well, we see outside of the grocery stores, those rat containers and, you know, poison bait, and at the dump you see it. And I'm wondering what the town might be doing or should be doing or about this issue, or nobody talks about it.
So we do have a requirement that before any building is torn down, before there's any demolition, that we need a report from an exterminator who's inspected the facility to ensure that if there are rats, that they've trapped them, baited them, and killed them, gotten rid of them, because we don't want the migration
Right,
associated with tear down. So we've recognized that for a long time.
right.
And so that is something that we have as a policy. So they can't tear a building down unless they do a do an evaluation of it and then, and take care of the problem.
And this is for the big commercial buildings
For any
as well?
building, it's for
every
home
building?
too.
And for
So,
homes?
for homes too, you know, all these tear downs of homes,
Right.
some of them have been vacant for a while.
Right,
So
right.
any tear down, any demolition project, they have to do this evaluation, and we require it. And we won't sign off on the demolition unless we received an evaluation. of the
So
property.
is there anything else that can be done, that can you think of, that, you know, that, because it's apparently there's more rats around than before?
You know, the thing is that it's private, if it's on private property, the person can hire an exterminator.
Exterminated, how about down like by the water, you know, down by, near water in that area?
I haven't gotten any complaints about that, and it would still be the same thing, you know, I mean, if I have, where I live, if I had a problem where there's rats coming onto my property, I would hire somebody to bait my
Probably they're all
property.
over apparently, you know, you just want them off your property.
I'm sorry,
I guess that they say they're all over the place, we just people have to try to keep them off their property through sanitation and the
Well,
garbage.
yeah, you know, I mean,
Christine, is
that's,
this a big secret? Because I'm not hearing anything about rats.
Well, I do, I've talked to some people about that
Where you
and,
live?
hmm?
There's rats where you live?
There's rats apparently there and around our area, near water, down by the post road. People have said where, you know, they went through the bottom of a dumpster, so, you know.
well, you know, again, you know, I see the bait boxes around. I know they're around.
Yeah, right, yeah,
And so, I mean, that's the world we live in though,
I know.
you know, and they're here.
And do you know what kind of bait they use at all?
No, I don't.
Okay, because there was something in the paper about a sick hawk that they had to take for care, and they said something about the anticoagulants and the rodent killers were getting to the birds or something, so I don't know what else they would use.
I don't know. That's not my area of
Neither,
expertise.
actually,
Oh,
but you're
bow and arrow.
environmental, you're environmental.
My grandfather uses 12-gauge shotgun.
A shotgun.
Right up there, right on the hill there, usually shoot.
My go-to person is always Chip Stahl, our animal control
Yeah,
officer.
okay.
I mean, he's really knowledgeable.
Okay.
He's really good. He's helped us when we've had questions, when we have had, you know, the complaints about rats and rodents. I will always refer and defer to him, and he's been very helpful.
Okay.
So, yeah, animal control would be a resource that is, I think, really good here.
I've seen things in next door neighbor, you know, people in town, you know, looking for, who should you call for an exterminator, you know, for this problem? So that's where you pick up some of the information too,
You know,
you know, where people are just asking about referrals,
Yeah.
yeah.
And, let's see. Moving on. Oh, there's an issue that I'd like to have your input on, and that is to use some of the opiate settlement fund for a project here in town that's been proposed through the community fund. And that would be for a teen talk counselor at the middle school. This would be they apparently have such a program at the high school, and it's been very successful. I have some literature here that I could forward to you, but we met with the community fund and the representatives for the organization, which is Kids in Crisis, to provide a counselor for the students that would be not affiliated with the schools. And I thought that that's going to provide for people who, you know, kind of want to keep things quiet and want to talk to somebody that they feel they can trust. Whereas, you know, maybe in the schools, they don't feel kids don't feel as comfortable with sharing information. with people who work at the school. So this would be a new initiative that we were asked by the Community Fund to partner with them, and ultimately also with the Board of Ed, to get a program going. And we do have opiate settlement funds that could be utilized for assisting with this program. And I would recommend that we go forward with it, but I didn't want to commit our involvement without running it by the board.
I think it's a great idea, fully support it.
Yeah, I think it's a good idea. My job is something similar to that, where outside person going into the school and helping children who have mental health concerns. And it could be anything. I work, in the primary grades, and I think it's been very helpful to kids, and not being part of the school and,
Right.
yeah, where they can just talk to someone and have any concerns, really about anything.
Yeah, and as you saw in that survey, the assessment survey, mental health is a concern, as is school bullying.
I saw that too.
Which really, that was one of the things that really kind of surprised me,
stood
that
out.
jumped out. It was, in one of the questions, it was identified as the #1 concern, for folks. So, yeah, I think this would be important, and, we'll work on the details with the town administrator and the first selectman, as far as
Yeah.
how much and for how long. Because,
So, yeah, obviously the kids are going home to their parents and complaining about bullying, since most of the parents are the ones who, and the mothers,
who filled
who
that
filled
form?
out and they're yeah. And they would need support too, the parents.
Yep.
Is the high school program pretty well funded for the opioid?
They're not, yeah, they're not, we're not funding them.
Mhm.
They're all set, that's through the
What's-
board, the Board of Ed is taking
So
care
that's,
of
so
that.
that, okay.
This is to expand it into the middle school, and I guess the Board of Ed was, I guess they were a little reluctant to commit the funds.
Mhm.
So, Community Fund asked for a partnership. And so, to get it going, and then perhaps, have the Board of Ed pick up some more slack as we get it going.
Mhm.
But I think this is important for us to do.
Yeah.
This would be off-site.
I don't necessarily think it has to be.
There was a program in Darien schools 40 years ago that was off-site for this, well, for mental problems. And there's a Cherry Lawn, which is now the park up there, Cherry Lawn Park. There used to be a school there, and there was a building, Board of Ed was there anyway. The kids could go there and not be seen, and it was the same idea.
Yeah.
And that worked quite well.
What this says is, teen talk counselors can meet the students where they are, at their home or public spaces. So you arrange it. You make your appointment, you arrange where you're meeting. And school employees, who would be doing kind of this mental health work, they don't have that ability to go off-site. So this is one of the huge advantages. It says, to date, the teen talk counselor at Darien High School has conducted 7 home visits, and it's just started. This is data, and this is February. So, can I have a motion on this to go ahead with?
We're approved unanimously, David.
Thank you. All right, I did circulate the community survey for the health needs assessment.
That was extensive. Is there gonna be a pop quiz on it?
Gosh, no, I hope not.
No, it was really, really good.
Yeah, a couple of things, 70% of those who responded have 2 or more children at home. So, there's that age group, Thing is, the problem is, second bullet, we are considerably behind schedule on this thing. And I'm really getting worried that it's not gonna be done by the time I'm finished,
What is that gonna be done?
to have the report
Oh,
finalized.
the final report, okay.
You know, we've been kicking things,
Down the
we
road.
got a serious delay at the beginning due to family health issues involving the main provider services here. And so we got pushed back quite a bit with that. And frankly, it's been slow moving even without that. So I don't know if there's other issues there, but I'm a little concerned about getting this done on time. And we did establish a date with the library to provide a presentation in mid-May. But I'm gonna say I'm gonna be surprised if we meet that. Because I have to say, I'm very particular about what it is we're gonna put forward. And, you know, I wanna make sure that it is comprehensive and as correct as it can be. And so we're not gonna accept anything that's not, you know,
Well, if you don't have it ready, or they don't have it ready by May, I'm wondering, since there was a big, a lot of problems with the mental health part, with people having mental health concerns, and May is mental health month, if there was something that could be still at the library, if we can't do the whole report, focusing on mental health, and getting some people in to talk to some.
good idea, so we'll keep the date.
Yeah, the parents and
Yep.
whatnot, providers in to help.
Okay, we
Yeah,
can do that.
yeah, May's mental health.
Just wanted to share my concerns with you,
Okay.
because,
Yeah.
we started this last August, and, the funding under this ELC2 was supposed to go away at the end of June of this year, but it's been extended for another year. I haven't told them that yet.
Okay,
So, as far as they know, they still have that deadline. But the money will be there to extend it. I want it done.
yeah, and you're gonna leave, you want it done when they go.
So. Anyway, moving forward, once again, for this, under new buildings and development, 6 new places opened again in the last quarter. That's 2 quarters in a row with 6 new establishments. And they really put an extra burden on us because they're still trying to iron out their own wrinkles operationally. And so we have to spend a lot more time with the new places that open than we do with those places who have been, for the most part. Because they have their staff, and they know what they're doing. But some of these places, they're throwing together a whole bunch of people who don't know each other, don't know the system, and really, in a lot of cases, don't know anything or much about food handling and safety. So we're spending a lot of time working on that, food safety issues. And also, the other thing, with all these new places, we found there's been some kind of a lack of coordination, shall I say, in some cases with the owners of facilities, maybe not communicating well with various departments here in Town Hall. With grease traps, with Public Works and building departments and fire marshals, and that they're telling one group one thing and another group another thing. So what I've really pushed for and initiated was to have, like monthly department meetings, with fire marshal, with building department, with P&Z, with Public Works. So we could go over all of these new places as they're coming along, so that we could have an open dialogue about, what the status is, what they told them, because we don't see the different reports from the different departments. Even though we're a small town hall, we're all kind of tend to work in silos. And
So I'm confused, so Public Works gets involved with things like checking grease traps?
they run the sewers.
Mm-hmm.
So as part of the sewers, they have to make sure that the facility that's being built has the ability to retain grease, doesn't get out into the sewer. So they do review grease traps for Public Works. That's one of their roles. Because if the grease gets out the sewer line, plugs the sewer line, we end up with sewage in the street or in the buildings. Don't want that.
Not on your watch.
Not anybody's watch.
Yeah.
That's a big problem. So, and grease in the sewer lines, you know, it's a big problem. And even with really good removal systems, there's still gonna be some that gets by, and so you have to have the constant services available to clean the sewer lines. But it's important with these new places, that review process and inspection process be done as the places are being built. And we haven't really done in the past, it wasn't that much of a problem because there weren't that many places. But now that there's a lot of places, we really have to coordinate what we're doing here in the town hall better than what we've done. And so, that's something that we're working on actively. As I mentioned earlier, our annual permit renewals have completed and we didn't have any late fees. That to me is remarkable. And we give 2 weeks beyond the due date. And then there's always those who say, gee, I just forgot. But this year wasn't a problem.
Is that a function of the new system and reminding people and automating it and everything like that?
No. But that might be something that happens with this new with the new program. Because it's got a lot of bells and whistles, and it should. No, we have to send out notices, and we send them out usually after Thanksgiving, letting them know that, permit renewals are due at the end of December.
Fair enough.
But it's all electronic now. We're not putting, stamps on envelopes the way we did 4 or 5 years ago. So, and we're also able now to take payments, over, online payments. So, we've moved a long way into this new digital age. Any questions about that? So, next, under COVID and reportable conditions and reportable diseases, we had some 300 test kits that we had distributed from, I think we got them in November. They're all gone. So people came and got them. We also know that recently there's been a change in COVID isolation guidance. No more stay at home for 5 days. 24 hours after you're fever-free without medication, you can rejoin the world. So we're treating COVID as like we would with pretty much any respiratory illness now. It's interesting, we do get reports on seasonal flu and COVID. It's part of our regular reporting that we get from the state. And flu cases are up higher than we've ever seen them. But did we ever really test for flu before? Most of the time people went to the doctor and the doctor said, oh, you have flu, and they didn't necessarily test and send it to a lab. But in today's world, people are checking to see if it's flu or COVID. So we're getting a lot more testing done that didn't used to. So I don't know that, that it's really that the flu cases are higher. It's just that clearly the reporting is higher. And I think it's like when you go looking for something, chances are you're going to find it. And that's what we found. And what's interesting too is that the numbers of cases for flu and the number of reported cases for COVID are about the same. So,
I thought it was interesting in the survey also about the percentage of people who either had COVID or had a family member with COVID. So I guess Adam, both of about 90% of people have had COVID in spite of the vaccine.
mhm.
So I thought that was interesting.
Yeah,
I
well,
don't
you know,
how to read that.
well, you know, kind of the rationale for the vaccine was that it kept you out of the hospital.
Right.
Yeah,
Didn't
it
necessarily
wasn't
mean-
to prevent COVID, it was just to.
They didn't know at the time really what, how it was going to pan out.
Because, you
That's
know,
what they said later on,
Right.
yeah.
so, you know, I mean, you look at, before the vaccine was available, there were a lot more hospitalizations and deaths. And once the vaccine became available, there weren't as many hospitalizations and deaths. And so it was a big difference. It, you know, didn't mean that people stopped getting it. It just didn't happen as bad as it did. And I think also a lot of positive cases and deaths, unfortunately, were in nursing homes and elderly care centers, where people didn't really know that much about how to manage cases. And we learned, in some respects, the hard way, but we learned.
I think they kind of had to change the definition of vaccine, really, because, people, originally it was meant to prevent, a vaccine would prevent,
I
but,
think they used the wrong word, they should have just called it a COVID shot.
well, they didn't know
like-
at the beginning,
like a flu shot.
The intention was, I think, for prevention, but it came out that it helps just mitigate or to lessen the severity.
Yeah,
of
which-
it,
Which really, again, became part of a political issue because it didn't prevent, and
Right,
it didn't do what a vaccine
with hopes
sort of
to,
promised.
what they
You know,
hope
like,
to
you
do.
take a polio vaccine,
Prevents it.
you don't get
completely.
mild polio, you just don't get it.
You just don't get it. And
Yeah.
so,
You know.
yeah, that's, in measles vaccine, same
Yeah.
thing, but,
Yeah,
so that was part of the problem, perception-wise, that caused a little bit more political controversy that it didn't prevent it. But I guess we're all moving in the right direction, right?
we're all here.
Yeah.
Radon, we still have a few radon test kits, free radon test kits available. So come by soon, get your radon test kit. It's the only way you can tell if you have radon in the house, and radon is known as the silent killer. So test your home. There's a little bit of good news in the radon testing program. We've done it now, this is the 7th year we've done radon testing in cooperation with the state, who gives us the kits. And, we've distributed almost 300 kits, received results from almost 200 properties, and 9% of the test reports that we've gotten had results that were over 4 picocuries per liter of air, which is the EPA recommended limit. 9%, it's not that high of a number, unless you're one of the 9%. But it also says for folks who haven't tested, it's a good idea to test because you don't know if you're going to be in that range. And radon mitigation is not terribly expensive, and it's better to know than to not know. And the test kits are free, so again, stop by, get a kit. And if you don't have any left, they're not that expensive to buy. I don't know, $15, $25 for a kit.
So do you have any idea of, if you have radon in your home, say, for example, just over the limit, say over just 4, right? How long would it take, do you know, for exposure of the person in that home to develop a cancer? Do you
They may
have any
never.
idea?
They may
That
never.
may never, or would be 20 years,
Some
10 years?
people, everybody's different.
I don't know.
You know, people who smoked all their lives and never got cancer, and then people who never smoked get lung cancer. So it's hard to
They don't have any
say,
kind of-
there's no way, because we're all so different. So the fact is that we know that radon causes lung cancer. Don't know if you're gonna get it, if I'm gonna get it, or who's gonna get it.
I would imagine.
But if you know the number, if you know what you have in your house, if it's 0, great. If it's over 4 or over 10, well, that's something to think about. And it's better to know than not, I think. I recommend knowing.
And I think, especially, I would imagine, and I don't know much about this, but with the homes and buildings being so tight now,
Yep.
you know, where our old homes are kind of drafty, you know, and I would imagine that the tighter construction might be more of a
Absolutely,
problem for people.
absolutely. And finished basements and working downstairs, you know, or working more at home in an
Oh, yeah.
office down the basement. You know, that would be
Keep the
considered to
window.
be higher risk. And so that's all I have to say about radon. And finally, I have not received any updates on Great Island. So I can't report to you about the arsenic removal process, project, or success or not. I don't know.
Are they remediating it? You know that?
It's my understanding that they're doing some vegetative growing things, grasses or special grasses and special vegetation that is supposed to kind of uptake the arsenic.
Then what do you do with the grass?
I don't have the report.
Well, if
Who
there is,
signs off on that?
I don't know.
That it's remediated?
I don't know.
I'm
I'm not involved.
No,
the state will sign off on the remediation.
State?
And there's obviously, if there is absorption and it's found in the grasses, there has to be a certified process for them to then remove those grasses.
And dispose of them, yeah.
Well, 2 weekends ago, when the Great Island opened, I walked with my wife around, and there's an area, I can't exactly remember where it is, but it's easily bigger than this room that was like flat, it was covered. And I don't know what that was, but maybe they'd done some digging there or something, but it had like a big tarp over it on the ground. And it was flat, so it was, maybe they had taken something out of there. But again, I'm gonna speculate, yeah.
So,
Talk about the state and things in the ground. Now is a lot of time that people are using the pesticides. I see walking that, I'm starting to see the signs that pesticide application from the, landscapers, whoever puts it down, commercial people. And I think, I don't know, I know, but I don't know if a lot of people know, it might be interesting to have the community be aware that if they're worried about pesticides, coming into their area or whatever with animals, that you can fill out a form with the state of Connecticut, the environmental section up there, for landscapers need to notify you if a neighbor, you put those addresses down if the neighbors are gonna have pesticide application. So I think that's really good to know if you have pets or growing food that on a, the hill might be coming down in your yard. So I thought the community might be interested in knowing something like that.
David, I was just kind of thinking out loud, but we have a public health and safety meeting this coming Monday night, and I could bring up on our agenda just to talk about this a little bit, that, we approved the purchase of Great Island as a body, the RTM, and maybe we should get a little bit of this information. And just ask for it.
yeah.
What do you think, Joe?
Good luck.
No, I've thought that for some time, as a health director, I asked for it.
Mhm. And maybe
But
we'll be
you can
told.
probably go after the information through the RTM.
I'm sorry, say it.
You probably go after the information through the RTM. They can't hold information back from you.
Yeah, just ask about it, it's just, we're not doing any, investigative, we just wanna know, that's
That
all.
certainly wasn't my
Yeah.
role either.
Of course not,
It's just
yeah.
part of,
But that's you're the committee that could do that.
Sure.
So, folks, that is my report for March 12th, 2024.
Thank you.
I have nothing further to add. Be happy to answer any questions if you have any.
Well, not to get all mopey, but is this our last meeting with you, or do we have one more?
That's it.
I'll stick around for one more.
Before you get on the
Then we can pass around the tissues.
I'll come in June.
So the next meeting is Tuesday, June 11th, 5 PM. We assume David will try to have it here.
Or, maybe at one of the, neighboring restaurants that we could,
Sounds.
Yeah, we'll have lots of
sounds like a
surprises
real
for you.
plan. Sounds like a plan.
one
All
of
right.
the new places just opened up.
Well, it is 6:10.
Well inspected.
I will close the meeting. Thank everybody for coming and great to see everybody.
We covered a lot.
Appreciate your time.
Thank you.
David, I'll
Thank
send you
you.
the notes. Thank you all very much.
Thank you.
Thank you.